Today, we're going to talk about what's the process involved with stem cell therapy. We get a lot of questions about what's involved with getting this done, because you need to plan. We are a country of planners. We plan for our retirement. We plan for vacations. We plan all our medical treatments with the nth degree of knowledge and trying to fit as much as we can into our daily schedules. So I totally understand this, because you need to make a commitment to this and you need to know what's involved. So there's basically 4 phases, and I'll go over each one of those phases. There's the evaluation phase, there's the preparation phase, there's the cell delivery phase, and then there's the post phase. So during the evaluation phase, you come in, we do a thorough evaluation looking at the whole person. We want to know what your social situation is. We want to know what hurts, where it hurts, how it hurts, what makes it better, what makes it worse. And then we do a thorough evaluation, not only of just that area, but other areas of our body that may affect it. So we want to look at your gait. We want to look at the joint above and below where you're having the problems, so that we can give you a whole picture. We also go over your x-rays and any other studies you have personally, so we can show you what you have. Then we go over a whole list of different options. Some of those may not be stem cell, but then we help you make that decision. And once you make that decision, then you go into the preparatory phase. The preparatory phase is where you've made that decision that you're going to have the cell-based treatment done. And so there we ask you to do simple exercises that take you about 15 to 20 minutes a day. That's like riding a stationary bike, going for a walk, and then doing a little bit of quad strengthening exercises. We also evaluate things that can help your joint, like modifying your shoe wear, changing your nutrition, setting up some goals for you about weight control and about exercise, and adding those in. We may even suggest a brace or a heel wedge. We may then look at your whole gait and try to correct your gait. So that's all in the preparatory phase. You also would stop some medications about 1 to 2 weeks prior to the procedure that may interfere. Those are normally like anti-inflammatory medications. Then we have the cell delivery phase. That's a visit where you come in and you see us, and you bring somebody with you. You take some medication that makes you drowsy. Doesn't put you totally asleep, but makes you drowsy, makes you relaxed. Then we have you get up on the exam table, usually right here in our office. Some patients who have more severe problems may need to be taken to a nearby surgical center, and we'll get you set up there. And then we draw off the cells. We numb up the area real well. That takes about 5 minutes. We then process it. It takes about another 20 to 30 minutes, and then we numb up the joint and then carefully inject the cells into that area. You can then resume most of your normal activities in about 24 to 48 hours. But we still then have you avoid things that are going to put stress on the joint. So that's things that are like running, jogging, squats, kneeling, and you do that for about 3 months. Those are probably things you're not even doing anyways. And then we go into the recovery phase, or the post-care phase. Some patients, but not all, may receive a second injection of platelet-rich plasma that is like a fertilizer for this process. That usually occurs about 1 or 2 weeks afterwards. But then you continue to protect that joint, continue to do all those goals that you set up for your shoe wear, about your weight control, about your diet. And that takes about 3 months. After 3 months, you come in, we have another assessment. And then at that point, you start to notice that it's getting better. If it isn't, then we go ahead and we try a couple other techniques to try to get you over that hump and start this whole process. Most patients take about 3 to 4 months before they notice a difference, because it takes that long to change the biochemical environment in your joint. So overall, it's about a 3 to 4 month commitment in about 4 to 6 visits. So I hope that laid out a plan of what's involved for stem cell therapy. Remember, these are your cells for your healing.